Hello, students. This is Dr. Henry, and I'm your instructor for DAT 120, which is Office Management for Dental Assisting. This particular guided practice video is going to focus on Chapter 20, which discusses the patient chart in the Dentrix Learning Edition. Depending on when you are viewing this video or when you are taking this class, there was either a prior class session or a prior video that walked students through the patient chart module for Dentrix. So it would have showed students each of the toolbars and what they do and how they work. This particular video, however, is focused strictly on the guided practice that's in Chapter 20. The topic of Chapter 20 is clinical records, so those things having to do with the patient's treatment and care in the dental office is what this will focus on. What I advise students to do is go to Chapter 20 and read through the pages first, and then come back and watch this video, and you may need to press stop, pause, or rewind as we go. But in order to save time, this video is going to focus mainly on the steps that we need to do for the guided practice. However, the additional information that is in between the steps is very important for all students to know. So, just as a recap, in an earlier video or in an earlier class session, I did go through each of the toolbars that are in the patient chart module for the Dentrix Learning Edition. For the rest of the way, we're going to be going through the guided steps, and the very first one talks about selecting patient Robin Cooper. I'm going to go to our Dentrix Learning Edition, if I can find which screen I have it on. So I'm going to go to where I have my Dentrix Learning Edition. This particular chapter is focusing mainly on the patient chart, so I'm going to open my patient chart. The way you open your patient chart may be different, but it should load similar to here, and you should also see what I see on my screen. Now, the first thing it asks us to do is to select patient Robin Cooper. Remember, by default, it searches on last name. So here, her last name is Cooper. When I type COO, she comes up. I'm going to select Robin Cooper. Then I'm going to push the screen up a little, and I'm going to click OK. And now it lets me know that I'm on patient Robin Cooper. And here we have the graphic chart. Notice that my mouse has now turned to the Explorer, which some of you may be familiar with. Here it tells us that we want to indicate that all of her wisdom teeth, or third molars, were previously extracted by an oral surgeon. So in Dentrix, you can note patient procedures that were done by a different dental office. All right, so what we're going to do is highlight the teeth that it tells us to do. So it says highlight tooth number 1, 16, 17, and 32. And in order to do multiple teeth, after I click the first one, I'm going to hold the control key on my keyboard. Then I'm going to select the other ones that it says, which are number 16 and number 17 and number 32. Okay, now we're going to note the extraction. So in the procedure codes button area, there are shortcuts. The one that we want has 2 lines going down the middle of it. So I'm going to click on it, and once you rest your mouse on it, it says extraction, and then existing other, because this was done at another place. Now I want you to notice what you see in our graphic patient chart. Notice that those teeth are gone from the graphic chart. And then in the procedure notes area, it tells us the date, it gives us the tooth, it gives the American Dental Association procedure code. It tells the provider, it gives a description of that procedure code. It tells us the status, which in this example is existing other, meaning it occurred at a dental office outside of our practice. And then the last thing, which we don't have, is the amount, because we don't know what that patient was charged and it wasn't done at our office. If it had been done at our office or was planning to be done at our office, the amounts of the procedures would show here. Okay, next it says, let's assume that Robin Cooper needs a MOD amalgam on tooth number 14. So it says we would follow the same procedures. We would locate tooth 14, we would select it. Then in the procedure shortcut buttons, now remember, these shortcuts are designed to make it easier or quicker for Dentrix users to add commonly used procedures. However, these same procedures are listed in the procedure codes area, and depending on what kind of dental office you're working at, if you're working with an office that does routine preventive care like, cleanings or, prophylaxis, or if you are working with an endodontist or periodontist, or if you are at a dental surgery practice, then you are going to become more familiar with those particular codes. And so your procedure code shortcuts may change based on your office, just to let you know. However, for us, we're using the default procedure code buttons that are listed, and this just makes it easier for us. But if we were to go to that particular code, for example, and locate it in one of these categories, if we clicked it from here in the code list, it would be the same as, clicking the shortcut button. I just wanted to mention that. So the book says I think we're on between pages 358 and 359 on tooth 14, she needs a MOD amalgam. And so it's this second button here. So I chose the tooth. I'm going to choose the procedure. And in this one, it is actually it says we want to do a treatment that is needed. So it hasn't been done yet. So it's planned. So I'm going to click on it. And notice that it has been added to our particular list, and it put it in the numerical order for the teeth down in the procedure codes area. Also, it added a particular red color to that tooth to let us know what is going on with that tooth, and then we can find that tooth in the progress notes area and see what the status is, because this has not been completed. This is something that she needs to have. And notice, because it is something that our office is recommending, you can now see the amount of that. And in our book, it talks about seeing or practicing with whether you could change the amount. So if you double click on pretty much anything in Dentrix, is going to bring up some extra options for you. So if we wanted to change the price for that for her, if it had went up, you could change it right in there and say, okay, so this is another step that your book says to practice doing. See if you could change the amount. Now, here's a word of caution. We are learning the Dentrix Learning Edition and practicing with what we can do. However, normally this would not be the way that you would change an amount for a procedure, because that amount will be tied to most likely a fee schedule that is set up by your particular dental practice. That's how the system knew what to pop in already. And so if you wanted to change a fee for a procedure, you would need to do that in the Office Manager module, which we haven't gotten to yet. But I just wanted to make that clear that normally an individual staff member wouldn't just go in and change individual prices. Even if the person had a discount, there are codes you can put into your system that you wouldn't do here at the chart level, but you could, which is what our book is having us to practice. So we were practicing changing the amount to $125. Click OK. It is now changed. All right, so that is pretty much the conclusion of what our book shows us as it relates to charting for a patient. So we've charted different status types. We've done different procedures on the teeth. Now we're going to look at the periodontal chart. There is a separate chart in Dentrix for monitoring the periodontal health of teeth and gums for patients. Now, normally those evaluations will be done by a hygienist or a dentist. However, you as a dental assistant may have to help with that in some way. So now it's telling us to go to a different patient, and then it's going to tell us to open the periodontal chart for that patient. The patient that the book says choose is Karen Davis. So again, I'm going to go to our select patient button and I'm going to delete out or backspace out what was there. I'm going to put in DAV and notice everyone with DAV as the first three letters of their last name comes up. I'm going to find Karen, then I'm going to click OK. Notice we are now on Karen Davis. And in the book, I'm on page 360, it talks about confirming that her third molars are missing. And it says if they are present, indicate they are missing. Well, this is just another way to practice what we just learned because as you can see, her third molars, tooth 1, 16, 17, and 32 are still present. So the book says to label them as existing other in the same way that we did for Robin Cooper. So we're there again to follow the book. We're just going to practice this again for Karen Davis. So I'm going to select each tooth. Remember to hold control to do multiple teeth. So 1, 16, 17 and 32. We're going to select the extract button from the procedure codes area. And the book says again, use existing other to note it was done at a different practice. So once I click that, those third molars are gone now, and it's been noted in her progress notes area. Now the book says click on the periodontal chart icon. And so here we're currently in the patient chart. And on the third, 1, 2, 3, third row, if you go over 4, 5, 6, this icon is the periodontal chart. Sometimes when you rest your mouse on it, I think because I've been clicking around on different pages, and it wasn't activated. So once I have this page selected or clicked on, once you rest your mouse on it, it should tell you that it's the periodontal chart. So I'm going to click on it for Karen Davis, and you'll notice that as it comes up, it's going to pull up Karen Davis because that's the patient that we were on in the patient chart. All right, so you can expand it or not, depending on whether you want to. I think this large view does make it a little easier to see. But I do want you to notice that those molars, 1, 16, 17, and 32, have a red M next to them because they are gone. And so the book talks about getting familiar with this particular icon or this particular periodontal chart. And so the patient chart is a primary module of the Dentrix Learning Edition, whereas this periodontal chart, which is inside of the patient chart, is what they call a secondary module, if you would. And so it has its own kind of icons. Notice some of these are similar to the ones that we also saw in the family file as well as in the patient chart, but we're currently in the perio chart. So this second toolbar here has some of the things we need to look at. So this very first one, if you just rest your mouse on it, says new exam. The next one is open, for example, an existing exam, save an exam, print an exam, and then delete an exam. You really want to be careful with deleting things in the Dentrix database because there again, the record is there to keep track of it. Now, whether the person didn't complete it or not, all of that information usually needs to be kept. Other options on here is the graphic chart. When you're doing something related to patient education and you want to give the patient a more in-depth view or lesson on what it is they're going to learn, then you may have the opportunity to use the graphic chart or do an exam comparison. For example, from last year versus 2 years ago, for example. Also, you can set up scripts. Now, I don't think our book goes this in detail with default. We're currently on the default script. And the script has to do with how the dental assistant wants to work when they are doing a periodontal exam. So before my time runs out, I do want to just get you a little bit familiar with here. So we talked about those 5 icons on that toolbar. Other things that you may want to take note of, we talked about her third molars are missing. Notice that along the top, we have tooth numbers along the top, and then along the bottom here. And notice that we also have these abbreviations. And so in your book on page 360 and 361, it tells you what each of these are. For the sake of time, I'm not going to read them, or I may have to do a second video to do that because I'm now out of town for this video. So please stay tuned to the next video. Thanks.